Hello, my name is David Gill and I'm a Learning Disability and Autism Adviser at NHS England.
Hello, my name is Ray James, National Director for Learning Disability at NHS England.
The Prime Minister is going to give us money for the next 5 years so the NHS will stay fit for the future. And learning disability and autism are both priorities in the plan for the next 10 years.
So the NHS long-term plan is about the next 10 years of the NHS, making sure that people get the access to the care, support and treatment that they need, and that they know what to do to help improve their own health and well-being. We're really pleased that services for people with a learning disability and autistic people are a priority within that plan, but particularly pleased that we've had a chance to work with colleagues looking at cancer, at heart disease, at mental health and other issues, so that they think about the needs of people with a learning disability and autistic people too.
Over the past month there have been loads of events up and down the country talking about what the priorities should be for the next 10 years regarding learning disability, autism and children and young people. We've had 2 national events and we've had a few regional events as well as a children and young persons event. I have been involved in 4 and we've had loads of discussions up and down the country over what the priorities should be.
So there were about 150 people that attended those national events, over 500 people who attended the regional events, and we've had lots of submissions online and a number of written submissions. Part of the purpose of this message is we want to say a really big thank you to everybody who's joined in and helped us to think about the future, and to assure you that we're really keen to continue listening to people as we begin to think about the decisions for the plan and go about implementing it with and for local people.
So Ray, could you tell us a little bit about what's going to happen next?
So we're taking all the things that people have told us. They've talked to us about the importance of ensuring that we do more work to stop people dying too early, that we improve health checks, that we make sure people can get reasonable adjustments, that's their right, not a privilege, and to ensure that everybody gets good access to the care and support they need, that they have a good experience of it, and that we get much closer to getting equal outcomes for people from all of that. We're now talking to other areas of the NHS in terms of the work that they've done on the plan, looking at where we might be better able to work together, and talking to those people that are going to be making the decisions. As you might expect, the funding settlement that's been announced for the NHS, lots of different people want that spent on different issues, and we need to build consensus about where the priorities are. We're hoping that the plan will be published in November, late November, there or thereabouts, and we will continue to talk to people, not just then, but also once the priorities have been decided, about how and why we should go about them, and which things we should do first, which things people think are more important than others.
And finally, a big thank you to everyone who's been involved in the discussions around the long-term plan. Thank you for your contributions.
We're really keen to keep listening, not just as we finalise the plan, but crucially as we begin to implement it in future years with and for people with a learning disability, autistic people and their families. Thank you.